Okay, so you want to like really get senior health insurance, right?
Yeah.
But without all the super detailed, confusing stuff.
Yeah, it can be a bit much for sure.
Well, think of this as your like cheat sheet.
Exactly, a shortcut.
You gave us some pretty in-depth materials, and we're going to break them down, make it clear, maybe even point out some things you wouldn't expect, and by the end, you'll feel good about this whole thing.
Feeling confident, ready to make informed decisions.
Right. So let's dive deep into, well, health insurance for seniors, all the options, and how it all works.
It's more straightforward than it seems at first glance. That's what these sources really reveal.
Okay, so first things first, Medicare. What is it, really?
It's the basis of everything. It's a federal health insurance program, been around since 1965.
Yeah.
Mostly it's for people 65 and older, but younger folks with disabilities might qualify, or if they have ESRD, end-stage renal disease. And the Centers for Medicare and Medicaid Services, CMS, they're the ones running the show. Funding mostly comes from those payroll taxes we've all been paying, throughout our working years.
Right. So turning 65, who gets Medicare automatically?
So a few things for those 65 and up. You got to be a U.S. citizen or a permanent resident, at least 5 years. Then either you or your spouse needs enough work history for Social Security or the railroad retirement benefits.
How much work are we talking?
Usually it's 40 work credits, which is, about 10 years of work. Or if you paid Medicare taxes for 10 years, you're good. Spouse did, same thing.
Okay. What if someone hits 65 and they don't have all those work credits?
Good question. Even then, they can still apply. But they'll usually have to pay the full premium every month, no subsidies.
Unsubsidized.
Right. Now, for the folks under 65 who are eligible, it usually has to do with disability.
I see.
If you've been receiving SSDI.
Social Security Disability Insurance.
Or RRB, that's Railroad Retirement Board. Benefits for at least 24 months. And can't work because of the disability. You're usually good to go with Medicare.
24 months. Is that always the case?
Well, there are a couple exceptions. People with ALS.
Amyotrophic lateral sclerosis or Lou Gehrig's disease?
Yeah. They get Medicare benefits right away once they qualify for Social Security disability. And for ESRD, coverage can start after a kidney transplant or once they've been on dialysis for 3 months.
And I was reading that ESRD coverage is kind of different if someone also has like insurance from their job.
You're right. So if someone has ESRD and their employer or their spouse's employer has a group health plan, that group plan is primary for the first 30 months of ESRD treatment.
So Medicare is secondary.
Exactly. Now, let's say you're eligible for Medicare. How do you actually use it?
Yeah. How does it work?
You've got two main paths. Original Medicare, that's the fee-for-service run by the government. It's got Part A, the hospital insurance, and Part B, medical insurance. Then you've got Medicare Advantage or Part C. These are like all-in-one plans from private insurance companies, but they've been approved by Medicare.
Okay, so original Medicare, what's Part A, the hospital insurance, all about?
Part A, that's your main hospital coverage. It helps pay for inpatient care at a hospital, skilled nursing facilities too, some home health care, hospice care as well. And with Part A, it's important to understand this idea of a benefit period.
Benefit period, what's that?
Think of it as how Medicare measures your inpatient hospital or skilled nursing facility services.
Okay.
It starts when you're admitted and ends when you haven't had that type of care for 60 days straight. If you get readmitted in those 60 days, it's like part of the same benefit period.
Oh, sure.
It's only a new benefit period if there's a 60-day break, so it's not tied to the calendar year.
So not like January to December.
Nope. So within each benefit period, what does Part A actually cover?
Yeah, what do you get?
You get up to 90 days of inpatient hospital care. Could be all at once, could be spread out, as long as there are less than 60 days between stays. And each new benefit period, you get those 90 days again.
So it resets.
Exactly, like a fresh start.
That's good to know.
And there's more. Part A also gives you an extra 60 lifetime reserve days. Now, those don't come back with each new benefit period.
Oh, so once they're used.
They're gone. Think of it as like an emergency stash of extra hospital days.
Okay, that makes sense. What about the costs for those hospital stays under Part A?
Usually there's a deductible right at the start of each benefit period. In 2021, that was $1,484. Once you've paid that, no co-insurance for the first 60 days of inpatient care.
Within that benefit period.
Right. For days 61 to 90, in 2021, it was $371 per day.
Yeah.
And for those lifetime reserve days, it's even more, like $742 a day that year. Here's the catch, though. Once you use up those 90 days A&D, the 60 lifetime reserve days, in a single benefit period. No out-of-pocket max after that. You pay for any extra days in full.
That's a lot to keep in mind.
It is.
Okay, what about skilled nursing facilities? Does Part A cover that?
It can, but there are some rules. Usually you got to have at least 3 days in a row as a hospital inpatient.
Before going to the skilled nursing facility.
Exactly. And you have to go within 30 days of that hospital stay.
Okay.
Then Part A will cover max 100 days in a skilled nursing facility, but only if you need skilled nursing or rehab services, stuff like that.
What about help with, like, everyday stuff? Like bathing or getting dressed?
That's custodial care. Medicare doesn't cover that.
Okay, important distinction.
Definitely.
So cost-wise, what's skilled nursing care like under Part A?
First 20 days, no deductible, no co-insurance either. But on day 21, in 2021, it was $185.50 per day.
That adds up.
It does. And after 100 days in that benefit period, Medicare's done. You cover the full cost from there.
Got it. Any other things Part A helps with?
Some home health care and hospice care. For home health care, usually you don't pay for the services themselves, but durable medical equipment, if you need it, like a wheelchair or walker, you cover 20% of what Medicare approves.
Makes sense.
Hospice care, that's for when someone has 6 months or less to live.
Right, right.
Usually there are small co-pays for hospice drugs, outpatient ones, and a little co-insurance for respite care. That's when someone comes in to give the main caregiver a break.
Oh, I see.
Blood transfusions, Part A generally covers it. But T, you might have to pay for those first 3 pints unless they're replaced through donation.
Interesting.
Oh, and there's a lifetime limit of 190 days for psych care inpatient. That's under Part A.
What about things Part A doesn't cover at all?
A few things. Private nurses, if you have a private room in the hospital, those first 3 pints of blood, unless someone donates. Personal stuff, like if you want a TV or phone in your hospital room, that's on you. And fees for surgeons or anesthesiologists who aren't employed by the hospital. Also, anything another government agency pays for, that's not Part A's problem. And of course, once you've used up those benefit periods and lifetime reserve days, hospital stays aren't covered anymore.
Okay. Lots to consider there with Part A. Now, Part B, the medical insurance, is that automatic too, like Part A sometimes is?
Not quite. Part A, yeah, it's usually automatic if you're getting Social Security at 65.
Right.
Part B, you choose. You can say yes or no, but it's good to know what it covers before you decide.
So what exactly does Part B cover?
It's for medically necessary services you get as an outpatient.
Meaning not staying overnight.
Right. So that includes seeing your doctor
Yeah.
at their office, a clinic, even if they're consulting while you're in the hospital but aren't actually employed by the hospital.
Oh, I see.
Outpatient services too. Lab tests, x-rays, medical supplies, and durable medical equipment. And a big one is preventive care.
Like checkups and stuff.
Exactly. Annual wellness visits, screenings for heart disease or diabetes, vaccinations. Often you pay nothing for these.
Wow, 100% covered. That's great.
It is. Like Part A, Part B also helps with blood transfusions. Same thing about maybe paying for those first 3 pints.
Right.
It also covers stuff like physical therapy, occupational therapy, speech therapy, prosthetics, and even some chiropractic services like spine adjustments to, corrective subluxation.
Okay, so pretty wide range there.
Definitely.
Anything Part B doesn't cover.
Oh, yeah. Just like with Part A, private duty nurses, intermediate or custodial care, or skilled nursing at home beyond that 100-day limit.
Within a benefit period.
Right. Routine vision, hearing, and dental care are usually not covered. Neither are outpatient prescription drugs, cosmetic surgery, routine physicals, and foot care, or chiropractor-ordered x-rays and tests unless they're for the spine subluxation.
Makes sense.
Things like acupuncture, massages, and if your doctor charges more than what Medicare approves, unless they accept what Medicare pays. Part B doesn't cover the extra. Then you've got things like services that another government program pays for, long-term care, unskilled nursing home care, and again, those first 3 pints of blood if it's outpatient.
A lot of specifics there. Cost sharing for Part B. Is there a deductible?
Yeah.
Co-insurance?
Yep, both. The deductible in 2021 was $203.
Annually?
Yeah, annually. Once you hit that, Medicare Part B usually pays 80% of the approved charges,
So you're left with?
20% as co-insurance. And unlike some other insurance, original Medicare Part B, no out-of-pocket maximum for the year.
Okay, so for signing up for Parts A and B, we talked about automatic enrollment, but what if you got to do it yourself?
If you're not automatically in, maybe you're still working, haven't started Social Security,
Yeah.
you got to take the initiative. Part A is usually a good idea, even if you're working. It's usually free.
No premium.
Right. Part B has this thing called the initial enrollment period. Yeah, it's a 7-month window around your 65th birthday, starts 3 months before your birthday month, includes your birth month, and goes 3 months after.
Gotcha.
If you get automatic enrollment because of Social Security, Part B usually starts the first day of your birthday month, so like October birthday. Your enrollment period's July 1st to January 31st, and coverage starts October 1st.
Okay, so if you miss that initial window, what happens? Can you still get Part B?
You can. There's the general enrollment period, that's
Yeah.
January 1st to March 31st every year. But ET, if you go that route, coverage doesn't start till July 1st of that year, and you might have to pay a late enrollment penalty.
On the premium.
Yep.
Are there, like, any special cases where you can sign up outside those times and not get penalized?
There is. It's called the special enrollment period. It's mostly for people working with health insurance through their job or their spouses,
Okay.
as long as the employer has 20 or more employees. Then you can sign up for Part B anytime while you've got that job coverage, or up to 8 months after your job or the coverage ends.
Whichever comes first.
Right. If you do that, you usually skip the penalty.
Okay, that makes sense.
Oh.
What about those monthly premiums for Part A and Part B?
Okay, so for Part A, most people don't pay a thing because they got those 40 work credits.
10 years of work.
Exactly. But with less than 40 credits, you might have to pay. Back in 2021, it was $471 a month if you had less than 30 credits.
And between 30 and 39.
$259 a month.
Still something.
It is. And if you gotta buy Part A but you wait, you get a 10% penalty on top of your premium for twice the years you delayed.
Yikes.
Now, Part B, pretty much everyone pays for that. In 2021, the standard premium was $148.50 per month. It changes each year, though.
Inflation, things like that.
Right. Plus, people with higher incomes pay a bit more. And like Part A, there's a penalty for waiting on Part B, unless your employer's plan covered you. This one's a lifetime thing, 10% extra on your premium for every full year you could have had it but didn't.
So basically, sign up early.
Pretty much. These penalties are there to prevent adverse selection. It's when people wait till they need care to get insurance. You know, trying to game the system a bit.
Okay, makes sense. Now you've got your Medicare. How do those claims work?
So when you get care that Medicare covers, your doctors, hospitals, they send the bill straight to CMS.
Centers for Medicare and Medicaid Services.
Yep. Then you get an explanation of Medicare benefits. It tells you what they did, how much it cost, what Medicare paid, and what you got to pay.
Okay.
Keep in mind, Medicare isn't always the primary payer. If you've got insurance from your job and they have 20 or more employees...
That's the primary.
Exactly. Medicare is secondary. Fewer than 20 employees, it flips.
Now, how do you know if a doctor or hospital will take what Medicare pays?
Medicare has participating providers. They've agreed to take what Medicare decides is the full payment, no balance billing.
Meaning?
Meaning they can't charge you the difference between their usual rate and what Medicare says.
Gotcha. And if providers not participating?
They can choose not to accept Medicare's payment, case by case. They can bill you directly, but only up to 15% more than Medicare allows. And you might have to pay everything up front and get reimbursed by Medicare later.
A bit more of a hassle.
Yeah. Now, you mentioned that explanation of Medicare benefits. Any other notices people should watch for?
Like bills.
Not a bill exactly. It's the Medicare Summary Notice, the MSN. You get it every 3 months if you used any Medicare services.
In the mail.
Yep. It's basically a list of everything billed, what Medicare paid, what you might owe.
Okay.
But remember, it's not a bill. It's just for your records. Explains what happened with your claims.
What if you disagree with what Medicare decides on a claim? Can you do anything?
You can appeal it. There's a whole process, but you usually have to start within 120 days of getting that Medicare Summary Notice.
How do you start the appeal?
One way is to fill out a form, the redetermination request form. You send it to the Medicare contractor listed on your MSN. Sometimes your MSN will tell you exactly how to appeal. Might be circling something, explaining why you disagree, and sending it back. You can also just write a letter to them, the contractor, asking for an appeal. Just include all the important info.
Like what?
Name, Medicare number, the service or supply you're appealing, and the date. A clear explanation of why you think they got it wrong, and if someone's helping you with the appeal, their name and contact info.
Okay, so that's original Medicare, now Medicare Advantage, Part C. What's the deal there?
These are those all-in-one plans we mentioned. Private insurance companies run them, but Medicare approves them. It's basically another way to use your Medicare benefits. The government pays the insurance companies a set amount for each person they cover.
How much is that?
These sources say it's usually around 95% of what the government would normally pay under original Medicare. In exchange, these plans got to cover everything Part A and Part B cover.
So who can get Medicare Advantage.
You got to be signed up for both Part A and Part B, and you keep paying your Part B premium and maybe a separate premium for the Advantage plan.
Okay.
You also got to live in the plan's area, and usually you can't have ESRD.
Unless.
There are some exceptions, like if you're in a special needs plan.
When can you sign up for these plans?
One big time is right after you turn 65, during those first 6 months after you get on Medicare. Usually no proof of good health needed then.
Insurability.
Right. After that, they might ask for it. You can only have one Advantage plan at a time, and if you get a Part D drug plan while you're on an Advantage plan, the Advantage plan ends automatically.
Makes sense. What are the different types of Advantage plans?
Several common ones. You've got HMOs, like the regular ones. They have networks. You pick a primary care doctor, usually need referrals. And you got to stay in network unless it's an emergency.
Okay.
Then there's PPOs. They have networks too, but they're more flexible, don't always need referrals. And they cover some out-of-network stuff, but it costs you more.
Makes sense.
Then there's PFFS, private fee for service.
Private fee for?
Yeah. You can go to any Medicare doctor or hospital that accepts what they pay. They decide how much they'll cover, not original Medicare.
Interesting. Any other types?
Oh, yeah, SMPs.
Special needs plans.
Right. These are focused on specific stuff like chronic conditions, or people on both Medicare and Medicaid, or those in nursing homes, that kind of thing.
Okay, that's helpful. What about prescriptions? Isn't that Part D?
It is. Part D, that's from 2003, specifically for outpatient prescription drugs, Medicare beneficiaries.
Right.
It's run by private companies, but approved by Medicare. They're called prescription drug plans, or PDPs. You pay a monthly premium, plus you've got copays or coinsurance when you get your meds.
Makes sense. Who's eligible for Part D?
If you're 65 or older and getting Social Security retirement, you can get it. Under 65, but you've been on Social Security disability for at least 2 years, you can get it. And anyone with ESRD or ALS qualifies too.
But it's not automatic.
Nope. Part D is optional.
Okay, good to know. When can people sign up?
The initial enrollment period's the same as Part B, 7 months around your 65th birthday. After that, if you want to sign up or change plans, it's usually during the annual open enrollment period.
The AEP.
Or OEP, yeah. That's October 15th to December 7th each year. There are also special enrollment periods, like if you move or lose other drug coverage, that qualifies.
Creditable coverage.
Right.
Can you get a separate Part D plan if you stay on original Medicare? What if you have a Medicare Advantage plan?
You can definitely have a separate Part D plan with original Medicare. Lots of people do that.
Okay.
But a lot of Medicare Advantage plans, they already include drug coverage. Those are called MAPDs.
MAPBs.
Right. If you're on an Advantage plan without drug coverage and you get a separate Part D plan, the Advantage plan will end.
Gotcha. Any penalties for not getting Part D right away?
Could be. If you don't get it when you're first eligible A&D, you don't have other drug coverage.
That's at least as good as Medicare's standard coverage.
Exactly. You might have to pay a penalty later if you sign up.
And how much is that?
It's a lifetime penalty. 1% of the national base beneficiary premium for each month you were eligible but didn't sign up and didn't have that other good coverage.
Okay, that makes sense. How do these Part D plans decide which drugs they cover?
Each plan has a list called a formulary. They usually organize it into tiers like generics, preferred brands, non-preferred, and specialty drugs.
And the tier decides your cost.
Right. Copay, coinsurance, all that. They got to cover at least 2 drugs in each common category, but not every single drug out there.
Right. Now, what's this donut hole I hear about with Part D?
Ah, yes, the coverage gap.
Why do they call it a donut hole?
So basically, it's a phase in your coverage. You hit it after your drug costs reach a certain point.
What you and the plan have paid combined.
Right. In 2021, that point was $4,130. Once you're in the donut hole, you pay a higher percentage of the drug costs.
Higher than before.
Right. But thanks to some laws, like the Affordable Care Act, the donut hole's been shrinking. Currently, in the coverage gap, you pay no more than 25% for covered drugs until your out-of-pocket spending hits another limit.
And once you hit that?
You reach the catastrophic coverage phase.
Catastrophic.
Yeah. Basically, from there on out, you only pay a tiny bit for your meds. Coinsurance or copay, very small. This helps protect people who have really high drug costs.
Okay, that's good to know.
Yeah.
So we talked about original Medicare, Medicare Advantage, Part D for prescriptions. What about Medicare Supplement insurance? Medigap.
Right. Medigap policies, they're from private companies, and they're specifically meant to cover what original Medicare doesn't.
Fill in the gaps.
Exactly. Deductibles, coinsurance, some excluded expenses, and they're standardized.
Standardized. I see plans A through N in the materials. What's that all about?
Yeah. So The NAIC, that's the National Association of Insurance Commissioners, they made these packages of benefits labeled A through N. Some of the old ones, like E, H, I, J, you can't buy those new anymore. But if you already have one, you're good.
And they added some new ones.
Yep, M and N came later. So now there are 10 Medigap plans you can buy. Only policies that follow these designs can officially be called Medigap.
Got it. Any recent changes to these plans?
Big one. Starting January 1, 2020. New Medigap plans can't cover the Part B deductible anymore.
The annual deductible.
Right. So plans C and F, they were popular because they covered that.
Mm.
You can't get those as a new Medicare person anymore.
But if you had them before 2020...
You can keep them. Or if you were eligible for Medicare before 2020 but hadn't signed up yet, you might still get C or F.
Okay, so what are the must-have benefits? The ones in all the plans?
They're the core benefits.
What are they, exactly?
Okay, so they cover Part A coinsurance and hospital costs.
For how long?
Up to 365 extra days after your original Medicare is used up in that benefit period. They also cover Part B coinsurance, usually that 20%.
20% of what Medicare approves.
Right. And they cover the first 3 pints of blood you might need each year, and Part A hospice coinsurance or copayment.
Got it. So how are plans A through N different then?
Well, besides those core benefits, plans B through N have other stuff. For example, all except Plan A and Plan B cover the coinsurance for skilled nursing facilities.
And except for Plan A.
They all cover the Part A deductible. Plans M and N, they don't cover the Part B deductible or Part B excess charges.
Excess charges.
It's when a provider doesn't accept Medicare's payment and they can charge you extra.
Up to 15% more.
Right. Some plans cover that, some don't. Some also cover emergency care outside the U.S.
Yeah.
Your materials have a chart that lays it all out, which is really helpful.
Well, that's good.
Yeah. Plans K and L are kind of unique. They cover a percentage of the Part A and Part B costs.
How much?
50% for Plan K, 75% for Plan L, but only up to a certain point. After that, they cover 100%.
For the rest of the year.
Exactly. Then you've got plans F and G. Some states have them as high deductible, meaning you pay for your Medicare costs up to a point, and then the Medigap plan kicks in.
Okay. So, rules and restrictions on these Medigap policies. What should people know?
Several things. Medigap can't cover what Medicare already covers.
Ooh, double dipping.
Right. And you can only have one Medigap policy at a time. It's always individual, no family plans. The benefits change each year to match Medicare, and you get at least 30 days notice of that.
And you can't add extra benefits like dental or prescriptions.
Nope. It's only for filling in those original Medicare gaps, accident and sickness-wise.
Okay.
And a big one, the rules for Medigap can't be stricter than the rules for original Medicare.
When's the best time to buy one of these?
When you're first eligible, for sure, during that 6-month Medigap open enrollment period.
When does that start?
First day of the month, you're 65 or older and have Part B. During that time, you can buy any Medigap policy in your state.
Okay.
Companies can't say no or charge you more based on your health.
It's guaranteed issue.
Yes.
So are these standardized plans exactly the same no matter who you buy them from?
The core benefits, yes. They're federally standardized. Makes it easier to compare. But the premiums, those can be different even for the same plan.
Depending on the company.
Right. The NAIC, they made these model rules that most states use, sets those minimum standards, defines what each plan letter means, so you know what you're getting.
Makes it less confusing, hopefully.
That's the idea.
Just to be clear, what are those core benefits again?
Okay, so you've got coverage for that Part A. Daily hospital coinsurance, days 61 to 90.
Okay.
Coverage for the coinsurance for those lifetime reserve days, too. And you get 365 more lifetime reserve days in case you use up the regular ones.
Whoa.
Then you've got 100% coverage for the Part A hospice coinsurance or any copays. And for the Part B coinsurance, that 20%, they cover that too.
Once you meet the deductible.
Right. Oh, and they all cover those first 3 pints of blood each year, which neither Part A nor Part B fully cover.
Sounds like a lot of rules and protections for Medigap.
There are lots of consumer protections. Like, you have 30 days to return the policy for a full refund, the free look period.
Okay.
And the rules can't be stricter.